Historical review for the 135th anniversary of the Junta de Beneficencia de Guayaquil. As the final decade of the 19th century approached, while most Western countries experienced a great economic boom as a result of the Second Industrial Revolution, Guayaquil was facing a sanitary crisis without proper attention from the state. The then president of the Municipal Council of Guayaquil, Francisco Campos Coello, proposed the creation of a board of notable individuals to manage the city's public welfare institutions such as hospitals, orphanages, and cemeteries. Thus, on January 29, 1888, the Junta de Beneficencia de Guayaquil was born. Founded by a group of philanthropists concerned about the living conditions of the less fortunate in the city, the institution obtained its initial funds from donations and legacies, which formed the cornerstone of its work. Throughout history, 7 of its members have served as presidents of the Republic. Thanks to the support and trust of the community, we have been able to transform the lives of hundreds of thousands of Ecuadorians over the past 135 years. Currently, the Junta de Beneficencia operates 4 internationally renowned teaching hospitals, providing over 4 million annual medical services, of which 90% are for patients with limited resources. We uphold the highest standards of humanization and medical quality through our transplant units, burn units, reconstructive surgery, and intensive care. The Luis Bernaza Hospital, an emblem of our institution, and declared a cultural heritage of Ecuador in 1989, became the country's most important transplant center in 2021, witnessing the first multi-organ transplant. The Roberto Gilbert Children's Hospital surpasses 1 million patient care visits per year and is internationally recognized for its technological advancements and the credentials of its professionals in all units. The Pediatric Burn Unit and the Neonatal Intensive Care Unit for preterm babies have provided crucial attention to hundreds of thousands of Ecuadorians since their establishment. The Alfredo Paulson Hospital, initially created as a replacement for the old Enrique Sotomayor Maternity Hospital, is an integral health center for Ecuadorian women. Over 1.8 million babies have been born under the care of the Junta de Beneficencia. In 2023, it will become Ecuador's most important specialty hospital, equipped with state-of-the-art technology, robotic surgery, and artificial intelligence. The Institute of Neurosciences, on the other hand, goes beyond its successful outpatient clinic, hospitalization, and treatments for mental health, neurological disorders, and addictions. It also serves as a home for numerous sick patients facing abandonment. Furthermore, since 2019, it has been offering free support and guidance for mental self-care, psychological crisis intervention, and suicide prevention through its Anima S.A. application, benefiting thousands of people within and outside the country. The Junta de Beneficencia also acknowledges education as a vital asset in people's lives. Therefore, our schools and colleges strive to promote high-quality education based on values. In 2022, the schools and colleges of the Junta, Unidad Educativa José Domingo de Santisteban and Santa Luisa de Marillac, introduced dual training programs, providing young individuals the opportunity to receive technical and professional education prior to graduation, helping them enter the workforce. In 2022, we assumed the administration of the Carlos Pérez Perazo Sports City and implemented the JBG Training School project. The aim is to serve around 5,000 children and young people until 2025, providing comprehensive assistance programs that include education, technology and robotics training, nutrition, healthcare, and family intervention to improve their quality of life. This translates into tireless work in preventing violence and addictions, placing a world of opportunities in their hands. The Manuel Galesio Home was founded in 1889, now located in Alausí. 10 years later, the Calderón Ailuardo Home was established to provide care for children and orphans. Today, these homes serve as shelters for girls in vulnerable situations, offering not only a roof over their heads, but also the warmth of a home, education, food, and psychological and spiritual support. The Corazón de Jesús Home provides specialized care and attention to older adults. In 2023, a new home for the elderly is being added in the LOC Canton, with facilities spanning nearly 4,000 square meters, which will provide them with accommodation and support with the highest quality standards. In 2022, the Rosa Eva Sánchez Aguilar Shelter became part of the Junta de Beneficencia. With its mission to alleviate the burden of those who suffer, it has already assisted over 10,000 individuals who have their children at the Roberto Gilbert Hospital, allowing them to find rest and nourishment while going through their illnesses. Since its inception, the Junta de Beneficencia has been responsible for the administration of the Patrimonial Cemetery, created in 1823 and declared a cultural heritage of Ecuador in 2003. The institution's mission extends beyond life, and acknowledging the city's needs, in 2012, we inaugurated the Metropolitan Pantheon, a new cemetery in Guayaquil, surrounded by 15 hectares of nature. In 2022, in light of emerging needs, we embraced the challenge of reaching out to and serving the people. We doubled our efforts and adapted to be where we are most needed. We extended our efforts to ensure that the services provided by the Junta reached every part of the country, offering healthcare, assistance to individuals with disabilities, food, education, and shelter. At the Junta de Beneficencia, we are a family of 5,000 workers, and we have the mission to multiply, reach out, embrace, heal, alleviate, provide rest, and nourish. Because for the Junta de Beneficencia, helping is the great work.